Extracorporeal membrane oxygenation, ECMO, also known as extracorporeal life support, ECLS, is an extracorporeal technique of providing prolonged cardiac and respiratory support to persons whose heart and lungs are unable to provide an adequate amount of gas exchange or perfusion to sustain life. ECMO involves centrifugal pump, heat exchanger, and oxygenator. Cannulation techniques for ECMO. The most commonly sites for percutaneous cannulation for establishing peripheral ECMO are femoral artery, femoral vein, or internal jugular vein. In central ECMO, right atrium and aorta are the preferred vessels. There are two separate configurations of ECMO circuit, venovenous, VV, and veno-arterial, VA. Both types of ECMO involve inserting two cannulas, one for draining the blood from venous system, SVC/IVC, to ECMO circuit, the other one for returning the oxygenated blood either to RA, VV, or to arterial system, VA. VV ECMO is to maintain gas exchange, oxygenation and removal of CO2, in isolated lung failure and preserved cardiac output. VA ECMO oxygenated blood is returned into systemic circulation, thus fulfilling two functions: gas exchange and circulatory support. Peripheral VA ECMO cannulation. The blood is drained from the IVC via femoral cannulation. It passes through a centrifugal pump and oxygenator and is returned to the patient via femoral artery. Central ECMO cannulation. Central VA ECMO is a separate entity. The technique is very invasive as it requires chest opening, and sometimes the chest may remain open for a few days. It is only used for patients who will imminently die. Central ECMO involves sternotomy and direct surgical cannulation of the right atrium and aorta. ECMO/ECLS provided by physician, insertion of central cannula, E, by sternotomy or thoracotomy, birth through 5 years of age. Insertion of central cannula, E, by sternotomy or thoracotomy, 6 years and older. A cannula is placed in the inferior vena cava or right atrium, allowing for drainage. This cannula is introduced at the internal jugular or femoral vein, accomplished by sternotomy or thoracotomy. The blood is pumped back into the patient through a cannula surgically placed within the ascending aorta, referred to as central ECMO/ECLS.